I'm going to spend just 5 minutes telling you our story before we kick off the morning. I'm sorry to start it off maybe with some tears in your coffee, but we'll get through it together. Some of you actually might be familiar with our story, and that's because we had to walk through this pretty publicly this past year because of the nature of my job. I was growing on TV, and I really didn't have much of a choice but to share with everyone what was going on. We received an anencephaly diagnosis for our daughter at 13 weeks in the womb last year, and on March 15th of this year, we said hello and goodbye to our sweet Emma Noel. She lived for 21 minutes, and those were minutes that we were able to hold her and tell her things that we had waited a long time to say. We were blessed with a cuddle cot in the 3 days after her passing. Can I see a show of hands who is familiar with cuddle cots? This was a generous donation from a family friend, and I had no idea what a cuddle cot was before this journey began for us. But in the 3 days after her passing, we were able to introduce her to our family. We were able to take pictures with her and just bond with our daughter. It really is the gift of time. And not only for us, but for the nurses and the staff who were better able to care for us and our daughter because of this device. And because I have all of your ears this morning, I just want to implore you that if you have influence in a hospital or a hospital group, if you know of a hospital that does not have a cuddle cot, please use your voice to make sure that every hospital has one for any families of infant loss moving forward. I have talked to many who have gone through the same process without one, and it would just be my hope and my wish that no parent has to walk this road without one. We are forever grateful for our daughter, Emma Noel, who has orchestrated for us an intimate and beautiful journey with her namesake, Emmanuel. It was in the ultrasound room when I initially received the diagnosis that I heard that name over and over in my mind, and I wasn't sure why, but it was just Emmanuel, Emmanuel. And so this time of year has become even more special for us, even more so than before, because we have come to realize how often God uses babies in his great plan for redemption. It may sound funny to talk about redemption as our daughter didn't survive, but what I want to express is that what we've come to find is that there is no condition, there is no fatal diagnosis even that can ever thwart a child's purpose on this earth. For Emma, that purpose was healing, not for her own physical body, but for literally thousands of hearts around the world who we heard from personally, who reached out and who were still in the throes of their own grief and who found hope and healing through Emma's story. That's a pretty big purpose for a 21-minute-old. In the 24 hours after our diagnosis, my husband and I were so shocked and so confused. We didn't know what exactly the diagnosis meant. We didn't know there was any chance for even limited survival. And I just want to express, some of you have walked through it yourselves, but for those who haven't, I just want to express that it takes time to process, to understand diagnoses, to wrap your head around what it actually means, and then to make really big decisions. When I initially heard 0 chance survival, I had no idea that it would come to turn out to be 21 minutes that would heal hearts around the world. Well, we are going to announce later today, but we are expecting again. It is pretty obvious. Thank you. So as we embark on this Christmas season, we are balancing some emotions. We are grieving still, but also celebrating. We are still remembering, but also anticipating. But most of all, we are so thankful that even through the deepest valleys and the darkest of days, we have been given the gift of Emmanuel, God with us. Another gift that we received through this journey is many relationships that we would have not had without Emma, many paths that have crossed, and one of those that I am so thankful for is the woman that I am introducing first. Dr. Kristina Box is the Indiana State Health Commissioner. She has been a practicing obstetrician and gynecologist in Indianapolis for over 30 years. She earned her medical degree at the Indiana University School of Medicine in Indianapolis. So ladies and gentlemen, please help me welcome Dr. Kristina Box.
Thank you. Thank you, Brooke, for sharing your incredibly personal story and for your incredible strength and compassion and faith. We are so blessed that you have joined us for this day. We're also so grateful for all of you in the audience who have joined us. It's amazing to me to see so many people with diverse perspectives and professions, but sharing that common goal of helping more babies celebrate their first birthday in the state of Indiana. Our Labor of Love Summit has certainly grown in the last 7 years. Today, you are an army of 1,500 strong and probably going to close to 1,600 with registrations we're doing right now. That's incredible. So give yourself a hand for being here for this. Those community connections are what we're all about today. As the State Health Commissioner and in my medical practice, I have seen time and again how incredibly important the power of community-driven solutions to big issues that impact Hoosiers is. The Labor of Love Summit is a wonderful opportunity for all of us who do work to improve the health of moms and babies across the state of Indiana, to gather together and to share what we're doing in our communities. I want all of you to work together today to find things that are working in communities across this state and take them home into your own community. You're here because you recognize that effectively tackling this public health problem, we must all work together. It will take communities working in unison to make sure that the needs of all moms and all babies and all families are addressed across our state. We need to address disparities and socioeconomic factors that we know prevent a woman from engaging in early prenatal care, sustaining that care for herself, and then establishing that care for her newborn. We need not only better safe sleep education, output and coverage for the entire state, but we need to change a culture about how we put our babies to bed in this state. We need to improve the overall health of our Indiana moms so that we have healthier pregnancies and healthier babies. These are not issues that any one of us can address by ourselves, but we can accomplish more together by linking women to services where they live in their community and linking those community-based organizations that oftentimes in their own community don't know each other exist. Whether you're a physician or a nurse, a doula, a community health worker, a public health professional, or a member of our faith community, I encourage everyone to make it a goal today, as I mentioned, to find something that you can take back with you today and implement in your community. Then let us know how it's working so we can all learn from your success. We are very fortunate in Indiana to have the support of our state leadership with our legislators and our governor as we continue to create new programs aimed at improving outcomes for moms and babies across our state. This isn't quick work, and it's definitely not easy. Some days it feels like we're taking incredibly small steps to me, but when I feel that way, when I feel overwhelmed, I just remember that all of the data we're collecting and all of that information represents individual moms and babies and families that we're impacting their lives all across our state. We are making progress, and we will not rest until we achieve the goals and the changes that we're fighting for. We will be the best in the Midwest for infant mortality by 2024, and that means also reducing our maternal mortality rates. It means making Indiana a place where moms and babies are not just healthy during pregnancy, at delivery, and for that first year of life, but those families continue to thrive far beyond that time. None of this work would have been possible without the support of Governor Holcomb. The governor, as you know, has set the bar very high for the state of Indiana, and I am confident with all of your support, we will achieve that goal. So thank you, Governor Holcomb. Thank you for your commitment to the health of our moms and babies. Thank you for giving us the tools that we need to be able to impact the health of our babies and our moms. And thank you for helping us to celebrate more first birthdays in the state of Indiana. Please join me now in welcoming the 51st Governor of the state of Indiana, Governor Eric J. Holcomb.
Well, good morning. How are you? How are the rest of you? Thank you, Chris. I'm thrilled to be with you all this morning, and let me just first say that the work that you do is, as Dr. Box just articulated, every single day, when at times it must feel like no one is noticing or paying attention, or are you getting through? It is noticed. And we are profusely not just appreciative, but we are proud. It was Alex Haley who once said, "Find the good and praise it." And that's my primary purpose for being here today, not to get you off schedule or get you behind schedule, but just to say thank you in every way that I know how. To see, Dr. Box just mentioned a lofty goal that we set to achieve by 2024. And there were some doubting Thomases, to be frank, when we set that goal and said, man, maybe that's just a little too high. But quite frankly, we were a little too low at the time. And then to see through my eyes today, but through my wife's eyes as well, every year this summit grow and grow, that I don't think that there's any goal that we could set that's too high. And so thank you. And I was told to expect about 1,500, and Chris just said 1,600, and I can tell you, Dr. Box, if the state fire marshal gives you any hassle, I know him. No one will be turned away, ever. And so, understanding that we have an incredible team, she threw some praise this way, but you all know the secret to success, and it's my perspective that gives me the confidence that we're going to get there. And knowing the team that Dr. Box has assembled here at the state with Eldon and Eden, and I called Dr. Box and Dr. Jennifer Sullivan and Terry Stigdon Indiana's angels. And they are angels here on earth walking among us. They've got the head and the heart. If you've met them for 2 minutes, you know they're one of us. You know why they're in this. You know they could be doing, just like you, a lot of other things that are probably a lot easier. But they keep coming back for more, to touch and to help more. And that's not something that's not rhetorical. That's not something you say just in the pew once a week. That's living the word. And to have that team and to have the partnerships that we have on the street, block by block, this is what's going to make an incredible difference, regardless of a zip code. And so early this morning, as you all huddle, and I wonder, we're learning from others, I'll confess, who are doing a better job from the state's perspective. But I do wonder how many rooms across the country there are. Brooke used the word purpose. I wonder how many rooms are assembled this morning for this purpose, And with this passion and a room that I can just sense being around Dr. Box and her team, who are undeterred by the challenge, who, as she said, sole purpose is that so babies can blow out candles on their birthday cake well after their first birthday with just help from their neighbor. Someone who's been there the whole time, maybe right across the street, maybe down the street. But again, living that word is what's going to make all the difference in the world for folks I know I'll never meet, but derive the same sense of joy from that bundle of joy. And so when Dr. Box and Dr. Sullivan, I keep wanting to say Dr. Wathel, she got married recently, so Dr. Sullivan, and Terry Stignan in our Department of Child Services, when they come and say, if we want a different result, we're going to have to do some things differently. I was talking backstage about ROI, return on investment. And we have to make sure that we are resourced appropriately, equipped to carry out, to not just meet this challenge, but to surpass it. And so when they come and they say, we need to do some things differently, we need to be rolling out levels of care, and we need to be conducting verbal screenings, and we need to roll out, as has been proven effective, not just around the state at the local and community level, but around the country, OB Navigator programs, and soon to be in 20 counties around the state of Indiana, targeted on those areas that desperately need it so much. Or improved parental leave policies at the state, or just yesterday what we rolled out. We have some state employees in the house today? Yeah. It's working. I mean, this again, this is not rhetorical. These are things that actually matter to people. We always talk about everything that we do, no matter if it's easy, like building a road, or hard, like making a heart not hard. What are we doing to affect positive change? And that's how we frame up, putting people first and frame up the ROI. And you all give me and our whole administration so much confidence to carry on smartly with the plan of the day, to use a military, Brooke, to use a military phrase. And healthy kids and healthy families, that's our only goal. And to be associated with you all who are in the trenches and who experience this, maybe sometimes all in one day, the heights of incredible joy as one of those bundles of joy is brought in to this world. And then the great depths of despair when we realize they'll no longer be with us. And connecting with the moms. I don't obviously need to tell this group this, but connecting with the moms, knowing that they are the true heroes. Certainly was my case. And my only wish is that my mother was in this room right here, right now, to hear me say that she was my hero, and maybe I'll tweet that later, but then maybe as important for that child to know that his mom's the hero is for the mom to realize she can be. And again, that's where I've seen you come in. And so whether you're a medical professional or an active community advocate, thank you. profusely. I thank you. And for the work that you are doing, this will be, when we look back and when we celebrate our progress, in 2024, when we do achieve that once thought of lofty goal, we'll take 2 or 3 seconds and we'll high-five each other, and then we'll double down, and we'll say that we're not just going to be the best in the Midwest, we're going to be the best in the country, because you're saving lives along the way. Thank you all. Have a great summit. Thank you.
Thank you, Governor Holcomb. All right, I have some housekeeping for you before we introduce our next speaker. To stay connected today, please sign up for the conference app, WHOVA. Instructions are included in your conference booklet. Also, each table has a centerpiece with the event hashtag for you to submit questions to presenters if you are not using the event app. So please note questions to presenters if you are not using them, please note to direct your questions to the specific speaker. Also, make sure to tweet your questions if you'd like to do it that way. Hashtag INLaborofLove19 to have your questions answered by those presenting today. Wi-Fi password, that's important. It is also on the centerpiece. It is Love 2019, Love 2019. It is not case sensitive. Also, today's lunch is sponsored by our Diamond sponsor, Community Health Network. Thank you, community. Additional sponsors include Ascension St. Vincent, Indiana WIC, Anthem Blue Cross Blue Shield, Indiana State Department of Health, HIV, STD, viral hepatitis, Riley Children's Health, March of Dimes, United States Drug Testing Laboratories, St. Joseph Health System, and Postpartum Support International. Can we have a round of applause for our sponsors, please? Also, our lactation stations are sponsored by CareSource, the Milk Bank, and Prolacta Bioscience, and are located in room 311 and 314 on this floor, 206 on the second floor, and room 107 on the first floor. The light breakfast, break station, self-check, coat check, posters, exhibitors, sponsors, please be sure to check them all out. There's so much good stuff.